Meet Sahar. Sahar has asthma. At her last appointment with her family doctor, Sahar saw a flyer about a research study that was looking to partner with people living with asthma. Sahar reached out to the team and is just about to join her first meeting to learn more about the research. When the meeting starts, everyone introduces themselves. Zoe is a teacher and mother to Colin, her 7-year-old son who has asthma. Zoe has had a really good experience with the teachers at Colin's school who have taught a lot of kids with asthma, but their family doctor just retired and she hasn't been able to find a new one yet, so Zoe is worried. Jordan is a photographer who has lived with asthma all his life. He's been a partner on several research projects before and is excited to show how he supported his previous team in using photographs to show how asthma was impacting people's daily lives. Michelle is a research coordinator who just joined the team and will be the main person that everyone should reach out to for questions about the study, their role, and anything else that will help them to feel like part of the team. And last is Mo, who is a family doctor and the lead for the research project. This lead role is called Principal Investigator. Mo explains that before he gets into details about the research project, he wants to explain the type of study this is and why it's a little different than other types of research. Mo says that the aim of their project is to get people to use the research that we already have. He says that it takes up to 17 years for research to actually get used, and this is just too long. The research says that having an updated asthma treatment plan has the potential to keep people out of hospital, and he wants to help physicians find easier ways to update those plans with their patients. Zoe asks, why does it take this long for research to get used? Mo answers that there are lots of reasons. Change is hard. Changing an individual's behavior is hard. Changing the way an organization works is hard. And changing a system is hard, especially a healthcare system. But this is why we need to ask about what are the barriers to change and how can we overcome them. Mo explains that asking these kinds of questions and building on what everyone else has learned by asking these types of questions is a key part of what is called implementation science. Implementation science aims to bridge the gap between what we know from research and evidence and what is actually done in real life. Sahar asks, what are the reasons that make it so difficult for physicians to update asthma action plans with their patients? Michelle, the research coordinator, responds that it's a great question and is what they are hoping to find out from this research. The team has already identified what other research has said could be the challenges, but the reason the team was developed was to confirm if these are the relevant challenges in the region we aim to support, identify new challenges, and most importantly, to try to find ways to support physicians to overcome those challenges. Michelle goes on to say that the research study aims to talk to healthcare professionals, clinic staff, people who inform policy, and to individuals living with asthma. The team is still planning this study and hopes that everyone on the call can help to develop that plan. Sahar now understands the gap between research and practice and how implementation science works to bridge that gap, making a real difference in the lives of people like her. But she still wants to know what is the role for herself, Jordan, and Zoe in this research. Mo explains that if they are interested, the three of them would become part of the team as individuals with lived experience with asthma. They would work alongside the other members of the team, including healthcare professionals, policymakers, and other researchers. The amount of time they spend on this work would be based on their interest and availability and within the research budget, as they will be paid for their time. The potential tasks would be discussed as a group, but could include planning how to recruit people to interview for the study, helping to decide the questions to be asked in the interview, and helping the team to understand the results we are hearing after the interviews. All members of the team would be encouraged to provide their feedback. As the team gets to know each other and plans the project, there may be other ways to contribute, such as if Jordan is interested in helping to use his photography skills to help the team share the research with others. Each member of the team brings their own perspective and expertise while we work together to find ways to support healthcare professionals to overcome barriers to updating asthma treatment plans with their patients. Sahar is impressed by the different ways individuals with lived experience are involved in implementation research and agrees to join the team. In summary, implementation science is about bridging the gap between what we know from research and evidence and what is actually done in real life. We all work together to improve the healthcare system so that patients can benefit from effective, equitable, evidence-based treatments, and so that it doesn't take 17 years.